Hey guys, I want to talk to you about mental health today because I've seen this epidemic absolutely go through the roof. Even before COVID, it was a huge deal, but it's gotten so much worse, I think, after the lockdowns and school closures and just changes in dynamics and relationships, especially in teenagers and young adults. I can't tell you how many people I see suffering with anxiety and depression. I remember right when COVID hit, there were 3 kids in my neighborhood that committed suicide in my neighborhood. 3, and it's a small neighborhood, and they were all in high school. And I've seen this go further and further and get worse and worse. But it's not a new thing either. I want to tell you about a patient named Eric, and Eric's, this picture is a little older, but I show you this because he's a perfect example of how these things happen. So he had been diagnosed with, he said, fatigue, depression, lack of motivation, anxiety, bipolar, and narcolepsy, which means he was falling asleep. And he said he had been diagnosed with 9 disorders, from bipolar to depression to anxiety to narcolepsy, I think to schizoaffective disorder. I was put on 12 different medications, from Zyprexa to Adderall, and his parents didn't know what to do. And imagine that being your kid, at 18 or 19 years old, being put on disability and being told, hey, you're never going to be normal. You're never going to have a normal life. You're basically going to be managing medication for your son the rest of his life. Nothing's going to be normal for him, and this is just him. He's just this way. And that, at the same time, it breaks my heart and infuriates me that's the model for people, that they're being told that your kid is just broken, there's nothing you can do about it. Because the truth of the matter is, there is something that you can do about it. There's a lot of things that you can do about it. And I know the doctors and the parents are well-meaning when it comes to this. They're like, I just want to help my kid, right? I just want to help my kid. But most of the time, there's things that you can look at and say, okay, how can we start to change what's going on in their head and the way they deal with the world? So what I did, and what I started with first with Eric, is we looked at the 5 essentials. So we looked at mindset. We looked at his spine and spinal function, because that's what controls all of those neurotransmitters. We also looks at nutrition, because the nutrition habits also control those neurotransmitters. Toxins, all right? Toxins in your body can interfere with the circuitry in your brain and cause depression and anxiety. Oxygen and exercise. Exercise has been shown to be more effective than antidepressant at reducing depression. Did you know that? More effective than taking Paxil or Prozac. So we started looking at these 5 essentials, and the first thing we looked at with him is mindset, which is, hey, and with his parents, hey, do you want to be on this the rest of your life? No. Are you willing to do some things different? Yeah. Do you believe that you can heal? Yes. And that was their thing. Like, yeah, I don't want him on these things the rest of his life. I think we can do something different. He's having all kinds of horrible side effects. He's not better, and he's still on disability. Of course we want to do something. So that was mindset number 1. But the primary 2 things that we looked at with him were nutrition and his spinal cord function, okay? Because spinal function is so what controls those neurotransmitters that they say you have a chemical imbalance for, right? That's what they'll tell you. If you have anxiety, they say there's not enough GABA. If you have depression, they can say there's a serotonin or dopamine imbalance. Well, my question would be, why? Like, why is my child having this? Or why are you having this chemical imbalance that you're having? So what we look at primarily, the first thing that we looked at with him was we took an x-ray of his neck, and he had a completely straight neck, 100% straight up and down. Instead of having that 45-degree curve where the brain can send messages out to the body and heal, he was at a completely straight neck. So those messages were not getting out to the body. The messages weren't getting back into the brain. And those messages to and from the brain is what controls the baseline neurotransmitters in your body. So C1 is what's controlling your serotonin levels, but also the motion of C1 and C2. Those things feed into your brain. So I want to spend a minute on this, because a lot of people don't understand this. Your brain runs on sugar when it comes to just energy, right? But your brain also needs to have an electrical charge, because what it's sending is electrical impulses. That's what runs your body. You are an electricity machine. What tells your finger to wiggle or your eyes to move or your food to digest is an electrical impulse from the brain through the nervous system. Now, how does your brain stay charged without electrical impulse? I mean, if you think about it, you have to charge your phone. You have to charge, like your lights in your house don't work if you cut the main line to the light pole, right? So that doesn't work. So you have to be connected to a source. There needs to be something. And if you do, your power goes out at home, what do? You have a generator. You crank that generator, right? So you have to get that energy so that the generator can supply your house. Well, your brain is the same way. You need to crank the brain to keep the voltage high enough to send those messages the way it's supposed to be, right? So what happens is when you have normal motion of your spine, now when I say normal motion, I mean each one of the bones are moving properly individually. When you have that normal motion and then you're looking around, you're tying your shoes, you're looking over your car or over shoulder in your car, C1 and C2 are moving like this. And when they move like this, 90% of the generator cranking in your body is at C1 and C2. So when you have normal motion of C1 and C2, that's sending electricity into the brain so the brain stays charged at a high level. And you know what happens when you stay charged at a high level? You feel good. Your mood is improved. You're not anxious all the time. You don't have chemical imbalances because the brain is set properly. There's a proper set point for the brain. Afferentation of the brain is what it's called. And you feel great when you do that. But what happens is people, they lose the curve in their neck or they get problems with C1 and C2. When you lose the curve in your neck, the first thing that's going to happen is C1 and C2 start to move as a block. They don't move individually anymore. They move as a block. And when they move as a block, you're not getting all those little mechanoreceptors sending that electricity into the brain. So when you move it as a block like this, your brain, instead of being turned up like on a dimmer switch really bright, starts to get dimmed down. And what happens when it gets dimmed down? There's depression. There's, I don't feel so good today. There's, oh, I think I have anxiety. I'm having panic attacks. Or I've been diagnosed with bipolar. All of those things happen because the brain function starts to get turned down. So with Eric, the main thing that we focused on was proper motion of C1 and C2, and then he started doing exercise to repair that curve. Well, what happened to him? So going from 9 disorders, from bipolar to narcolepsy, and on 12 antipsychotic medications, can you imagine 12 mind-altering medications the way you feel, walking around like a zombie? He said, after starting care, I was able to get off of all my medications. I have great energy, a full-time job, a beautiful wife, a baby. They have 2 more kids now. They are amazing people, and that never would have happened if somebody hadn't told him about chiropractic. And you know what I got when he came in? I didn't get, oh, I'm skeptical. I got, please help me. That's what I got. You know, so sometimes I'll hear like some of our patients say, well, I've already told everybody I know. No, you haven't. You haven't. Because there's people like him that are in your life. There's people like him that sit next to you at church or a coworker or, you know, live across the street from you, and they're begging for an answer. They're literally begging for an answer because they don't want to keep doing what they're doing. So I appreciate, if you've referred somebody in here, I appreciate that more than anything. But I also got to tell you, there's other people around us always that need our help, right? So I want you to be on the lookout for these people. If you have anybody in your life who's dealing with depression and anxiety, if you have kids that are dealing with depression and anxiety, I'll come I'm going to do a talk in a home for a homeschooling group soon. I speak to kids, I speak to parents. The way I reached him was I did a talk at a church where it was called Parents of Depressed Children, and that's the way I found Eric and his mom Cindy. I met Cindy and she came up to me after the talk and said, would you please help my son? Right? So those are the people that need to hear from you and need to hear from me. So wherever you want to see us in the community, fill out one of those blue sheets so that we can get in the community and set up these talks to help these people. If you know somebody dealing with this, refer them into the office, give them one of the lifesaver cards, bring them with you to one of the patient appreciation days, because the difference in his life now compared to what the doctors told him it was going to be is night and day difference. And I will tell you, if anybody says the doctor just says, I'm going to have to live this way the rest of my life, or I'm going to be stuck on this drug the rest of my life, all you have to do to prove the doctor right is do nothing except what they say. Because if you don't do anything other than what they say, I just had a patient who got put on metformin and he said, you're going to take this the rest of your life. That's a diabetes medication. You're going to take this the rest of your life. And I said, well, if you don't do anything different, of course you're going to have to take this the rest of your life. But what did we do? We started changing his diet, started doing the things that we told him to do with his diet. We coached him through that. Guess what happened to his diabetes? Gone. Guess what happened to the metformin? Gone. Right? Because what did he do? He said, no, I'm going to take responsibility for my health. So that's what people will do if you give them the chance. So again, if you know anybody dealing with depression or anxiety, that's like 9 times out of 10, that's a chiropractic problem that can be helped tremendously through motion at C1 and C2, and then even more through implementing these 5 essentials. So get out there and be a hero.